Hello, Danjuma.
Hello, good afternoon.
How are you?
I'm good. Happy to be with you.
Likewise. Are you comfortable?
Yeah.
Can you start by introducing yourself?
Yeah, my name is Danjuma Ibrahim. I'm from Gombe State, Northeast Nigeria. I'm an educationist and a development worker. My call is on immunization because I'm passionate about it.
Why are you passionate about immunization? Why do you like what you do?
Because I want to help humanity. I believe I have the ability and the capability to be able to do that because it has been my calling. It has been my passion right from childhood.
How did that become your passion? Why are you passionate about that?
Yeah, the area where I'm coming from, there is problem of insurgency.
Okay.
Yeah, we discovered that people that have joined some of those groups has to do with people that were abandoned at childhood.
Wow.
It's either the parents gave birth to them and they abandoned them, or the parent died and nobody to take care of them, nobody to provide for them, and nobody they could attend to. So I felt as a member of the society, we cannot continue to fold our arms, to close our eyes and turn our backs on those group of people, because whatever they are doing or whatever they're going to be doing is going to come back on us.
Mm-hmm.
Yeah. So I felt there is the need for somebody to do something, and we must have to start from somewhere. And that was what motivated me to go into development work to provide support and care for the orphans and vulnerable children in our midst.
That's amazing. Yeah. You work in an area that's not easy, from everything that you said, the context, the history, and you work on issues that are very difficult.
Yes.
It must be hard to continue to do that, even emotionally, to continue to have the strength, difficulty after difficulty, overcoming after overcoming. Is there something, what keeps you going? Are there at least some moments of joy or some moments of or some encounters that give you the fuel to keep going?
Yes, I got inspired by a community ward head that I paid a visit to in one of the Saturday mornings around 10 a.m. The place is 30 kilometers away from where I am. Upon arriving at that place, I met Madam Umar, who is the community head, because we had an interaction with him before coming, and I informed him about my coming, so he waited for me. I met him in front of his house.
Mm-hmm.
He now ushered me into the parlor. There were 3 seaters, so he sat down and offered me one of the seats. So as a mark of respect, I felt, let me just sit on the floor. Because in my place, when you go to elders, you always show, that kind of respect.
Absolutely. So
we started talking. The man is an elderly person. He has beards with some gray hair. So we started talking. We talked about a lot of, societal issues, vices, and what have you. To the point we got to a point where we raised an issue on immunization, and I picked interest because that's my area of concern. Yes. So I began to ask him, what is your impression about immunization and vaccine? So he was telling me, well, they don't believe in immunization. And I said, why? Because I became curious. Why? He said, because culturally, they believe if you take immunization, it's going to make you impotent as a man.
Mm.
Yeah. And on the part of the women, it makes them become barren because it's something designed to make people, not to give birth in order to reduce the population of people in Africa.
Right.
So I now said, but I don't think if that is true, because you don't have any concrete source to tell that, your position is right. So we continued talking to the point that I was able to convince him.
Mm-hmm.
Yeah, and he became convinced, and he was now telling me that, he never knew this is the situation because in their own context, they don't have formal education, they have not gone to school, and they felt some of the things that they discuss around is, what should be their center of focus. And I will try to find out whether if there has been any intervention or anybody from the government side that has been visiting them. He said, no, sometime even when there is an immunization activity, they only see people coming around to try to administer vaccine to their children. So they never get engaged. So it was at that point I got to know that sometimes it's not just about the cultural disbelief or the cultural belief or the religious belief or any pattern of belief, but the problem of engagement. Sometimes some of this, health officers go to the communities at the point when they want to carry out their activities without actually engaging the community members beforehand. So that inspires my passion to continue to do more, because it really aligns with my mother's legacy and aspiration, that when I grow up, that is what she wants me to become. Yeah.
And spending time one-on-one with people, listening to them,
Yeah.
which is the beauty of that experience, just going in with the humility and the respect that anybody deserves. If you're trying to bring something or a conversation with somebody, how do you sit with them and with respect, listen to them, and just make sure that it is a conversation and it's not an imposition of somebody, do this because I said this to you, do that because I said this to you. Is that something now that you take into everything else that you do? How is that impacting? And how are you now viewing the engagements and the relationships that you have?
Yes, it's about the engagement, coming close to the people, talking with them, sitting with them, understanding them, knowing their problems, getting their views, convincing them, showing them that they are important, they have value, and they could do something better. Sometimes you have to go to the extent of making a reference with other individuals, some influencers within the society. Let them see the importance of those influences and they reflect on their own children.
Absolutely.
Yeah, giving the impression that their own children could become those people who get into their position or even beyond. Yes.
I believe every interaction, even if you're there to share something, you also learn something.
Sure.
I want to ask you, you said Mada Omar, his name?
Mala Omar, yes.
Mada Omar. Did you learn something from him?
Yeah, I did.
What did you learn from him?
I learned, being humble, being compassionate. You try to share their own problem with you. Try to put yourself in their own position, telling them or showing them that their problem also is yours. Makes you, to have that sense of accessibility and acceptance from them.
What did he teach you?
He teaches me the importance of being myself.
Okay.
Yeah.
How were you yourself in this moment? And what did you take from this interaction? Because you're talking about what he learned and how open he was to receive you, and how the way in which you came to him with humility helped create an environment where you could have an honest and fruitful conversation. He's an elder man, like you said. He's respected. He's a community ward head. I'm sure he has a lot of wisdom as well. Did you pick some of that wisdom? And if yes, what are some of the things that you picked from him?
Yeah, I did. Yeah, I tried to reciprocate that by, paying back by listening to him. Mm-hmm. He showed respect to me, even though I'm not up to his age. So I listened to him. I was very patient, and I tried to reason along his line of thinking. Try to show him that the problems are not just theirs. It's a societal problem, and they also need to get along.
What did you do after that meeting?
I show appreciation by thanking him and by promising him that I'm going to do all it takes within my powers and capacity to see that the authorities continue to engage them in all health-related activities that will be coming to the communities.
Were you able to?
Yeah, I
How?
did. Yeah, I did. I reached out to the State Primary Healthcare Development Agency. In fact, it was one of the reasons at the moment the agency has introduced a kind of strategy that whoever is attending the facility will be given a stipend or some kind of gift to continue to encourage them to be coming. Mm-hmm. It wasn't there before, but they have now started. Even though there are challenges to that, from my own thinking, because I tried to look through and felt, what if, the gesture stops? What is going to happen?
Right.
Yeah, because we need to look at the sustainability plan for some of these approaches.
Absolutely.
Yeah, so we are working towards that.
So the challenge is you don't agree, I understand that, we should be giving people money for coming to the center. Because if the day the money is not there, then, and the question is, obviously, are people coming because they're convinced, or are people coming because there's a stipend?
They're coming because of the stipend.
Absolutely. And if there's no effort made into having those difficult conversations, meeting people where they are, listening to them, to what will motivate them to be able to access immunization, then it sounds like we're also paying people to get vaccinated.
Continuous engagement.
Okay.
Yeah, and that is what we are doing. The last time we had a meeting with them, what I did actually was I tried to engage one of the community members that is having a challenge with polio. He was affected by polio, but his children are healthy. So what I did was, when we went for the engagement, I asked him to share his story with the other members of the community. So the reason for doing that is to give them the impression that going to facility is not just about you getting something in return, but for the health of your child, for the health of the society. Because he shared a story telling the community members that he had a challenge of polio because he was affected by polio, and that changed his life. But that did not stop him from taking his own children for vaccination. So you look at them, because they were there surrounded by him, they stood by his back, and everybody was happy. So I think if we continue to go in that direction, it is going to have a lot of impact to change their view, their behavior, not just taking their children or their wards for vaccination simply because they are going to get something in return, but for the health and benefit of the children as well as themselves.
Those are perfect last words.
Yeah.
For the health and benefit of their children.
Yeah.
I want to end by asking you, what are you in service of?
I'm in service because I'm passionate. I'm passionate because I want to see a health-free society. And I want to see a society where each individual is going to be recognized based on his potentiality, ability to be able to support others, and for the society to also benefit from him or her. Yes.
Thank you.
Thank you. My pleasure.